Hello everyone, my name is Bruno Denis and today we will discuss about unified communication solutions such as Cisco WebEx, Microsoft Teams, Zoom, Apple FaceTime and other in an healthcare context. Are they safe? Are they functionally enabled for medical practitioner to discuss with their patients? Yes or no? Those will be the questions that we will answer today. The first question we ask ourselves today is, what is a digital collaborative workplace solution for medical practice? Our world is fully digital, and obviously the medical practitioner are following exactly the same path and same trend as we do, and are part of humanity as we do as well. Besides the pure medical equipments that each practitioner uses in its practice, it consists of the set of digital tools that practitioners will use to organize their daily activity. It will typically consist of different elements. The key elements are hardware, of course, such as mobile phone, PC, laptops, tablets, connected digital services, watches, scales, monitoring system, scanners and monitors. But it's also a lot of software elements like digital calendars, access to electronic health records of patients, access to healthcare public body for official medical nomenclature, for instance, of reimbursement procedures. All those technological advancements have gradually revolutionized the way that medical practice is being organized. If you look at the picture here, you can see that there is a huge evolution between the year 70s, for instance, and 2020s. Here is a typical example of a dental practice where you see that everything has been digitalized, from scanners, imaging systems, patient data, which are kept digitally, while in the 70s everything was analog yet. So there's been a huge advancement, and of course it leads to a better productivity for the practitioner and also a better care for the patient as well. So in continuation, we will focus mainly on one element of the digitalization of medical workplace, which is digital communication using cloud-based chat, audio and video services. Stay tuned. The second question we ask ourselves is, what are the key drivers for medical practitioner to further digitalize their practice? The first element is that they need to be faster. They spend less time now than they used to do 10 years and 20 years ago with their patients. In average in the US in 2018, they spent only 17 minutes with each patient. The second element is the massive availability of inexpensive networking computes and storage technologies. The third element is the gradual further adoption of full digital culture through people generation. So the new patients, generation Y and Z, are obviously keen to use those technologies, to go to their doctors, to meet them and to interact with them. And they want to have access to far more information that the older generations wanted to have. The fourth element is incredibly significant increase in the availability of medical relevant data at worldwide scale. Everything in hospital and clinical environment is now digitally made available. It's linked to the patients. So we have a gold mine of relevant patient data that can be used by practitioner on a daily basis. And the fifth element is the massive deployment of those EPR. So you have those patients records in different silos, but now that you try to combine all those electronic patient record systems in one unique system, you can really start correlating a lot of information for the practitioner itself and for a subset of patients. The third question we ask ourselves is, what are today's key practical examples for using digital collaboration services? Meaning chat, audio, video, and unified collaboration. And this in a medical context. So I will make now a distinction between two distinctive care environments. The first one is what I call inpatient, meaning for more acute care process occurring at hospital or clinic. And then outpatient for regular ambulatory care process and visit to general medical practitioner. In an inpatient context, there are no plethora of new usage of remote collaboration service to maintain communication between patients and their family and maintain communication between caregivers themselves. A relevant first example is the case of Houston Methodist Hospital. You know, when COVID-19 started at Houston Methodist, they found out that they really needed to organize better the discussion between the intensivists in New York and the operation center clinicians. So they really created an ecosystem of technology to have inpatient rooms so that teams could collaborate via two-way audio, high definition cameras. They used, in this case, Cisco phone systems. So the idea is really to make sure that also the mobile cards would be equipped with iPad device to extend the tele-ICU support throughout the Houston Methodist premises. So it's really a good example of how, you know, a combination of digital technologies being used for in ICU units to treat COVID-19 patients. Other example is what has been done to experiment virtual rounding in COVID-19 ICU units in University of Minnesota. So Dr. Michael Asher, conducts a really interesting research on the effectiveness of the virtual rounding. The idea is to limit and reduce the PPE use, so the protective equipment, as it helped patients being treated for COVID-19 to feel less isolated. So by using virtual rounding system, it's a good way to make sure that you do not displace in person some practitioner, but rather you provide more opportunities for them to interact with their patients. So the virtual rounding system is a really interesting solution to gain time and also personally deliver test results, for instance, before going home for the day, rather than making the patient wait until the next rounding. So all those methods of virtual rounding are very interesting in this technology, which is enabled now in a COVID era, let's say, will stay and it will never go back. So virtual rounding, in my view, has very interesting tangible benefits. It allows to have better clinical workflows, protection for all the parties, and access also for personal touch on a more regular basis. Another example is in Australia, when the Australian government announced a 2.4 billion Australian dollar investment health package to combat COVID-19. So they really went into funding a new Medicare service at no cost for patients, using telehealth consultation. As Australia is a massive continent with a lot of remote areas, they are used to use telemedicine already, but they've been increasing those throughout a free 24/7 national phone line with a support which is totally reimbursable.
This concludes our webinar today. Thank you so much for watching.
Interesting
Any
way
question, please reach out to me
for
via the email.
technological solution in a context of telemedicine, and certainly in this epidemiologic context of COVID-19. So as you can see, COVID-19 is obviously a very key factor for the transformation related to telehealth, as you can see below on your screen. So yes, it did change the outlook for telehealth for the consumers. It did change also the health systems and the provider processes, where you have now 50 up to 175 times more telehealth visits now than pre-COVID. So it changed dramatically the scene for telehealth. The same is true for regulatory elements, where it has been expanded extensively. In the US, with Medicare and Medicaid service, there has been approval process for more than 80 new services to lift restriction for telemedicine. So, in a nutshell, this is happening. COVID-19 is a key enabler for telemedicine today that will remain for the future. So after looking at the different factors that had an impact on the way that communication between the patients and medical practitioner got digitized over time, now let's have a look at who are the key technological solution providers for new modern digital workplace solutions that include chat, audio, video, and collaboration that can be used in a medical context. While doing research, I found out 5 or even 6 largest services for professional business-to-business communication. Obviously, you have Microsoft Teams, which is the successor of Skype for Business, which is hugely used by companies all over the world. You have Google Hangouts, you have Workplace by Facebook, you have Slack, you have Zoom, you have Cisco WebEx, that are, in my view, the largest one being used in a professional context today. Now you have also a lot of free services rendered by business to consumer services like Apple FaceTime, Facebook Messenger, WhatsApp, House Party, and others. And then last but not least, you have also new specialized medical messaging apps that have been launched recently, which are only made available to medical practitioners that authenticate themselves via their official medical public code. Companies like Silo, for instance, very present in Netherlands, Hospify in the UK, MedicBleep, MedCrowd, ClickDoc, Doctena, and others. In the next session, we will compare all those tools and find out whether there are large differences from a functional, but last but not least, also from a data privacy standpoint. So stay tuned. Before going to a full comparison of all the digital tools, let's first have a view on how patient and medical practitioner can respect the inherent privacy of their communication while using those new digital collaborative workplace solutions. As new digital workplace communication technologies have been gradually introduced, key priorities, obviously, of those solution providers were focused on client satisfaction related to the quality of audio and video and chat and instant messaging functions. But, recently we also found out that public regulation related to data privacy in a digital context becomes also a very important element for public authorities. So those data privacy regulation being GDPR in European Union, HIPAA, privacy and security, NHS, DCB, NEN, and you have plenty of them in the different countries of the world. They have also a very detailed chapter now on exchange, storage, and processing of healthcare data. The reality, though, as you can see on your screen, and you can relate to the document as well that I've been posting, is that the world is extremely fragmented in terms of generic data privacy rules. A lot of part of the world operates through different regulatory frameworks, and you have safe area. Europe is relatively safe. You have restricted areas like Russia or India, and you have very unsafe areas. So there is a very large discrepancies in the framework related to generic data privacy, certainly in an healthcare context. So those regulations create a framework that service providers should use to gain trust with medical practitioners and patients, create the necessary technologies that will natively respect those data privacy, and control dynamically those technologies to ensure practical compliance to those regulations. So in regards of those data privacy related to healthcare, it's important, I believe, to reiterate some fundamental principles related to how data is governed between different stakeholders, as I explain it below. So we have different key roles in patient data ownership, and I took here the GDPR as a base, which is one of the strongest and more structured way to look at data privacy. So you have different elements. You have data subjects, data controller, data processor, steward, custodians, and data owner. So in a nutshell, in an healthcare context, the data subject is you, the patient, the citizens. Then you have the data controller, which are the healthcare providers, the clinical research organization, the pharmacy, public healthcare bodies like NHS in the UK, for instance, or health insurance. And then you have the data processors. And the data processors are those companies we are talking about. The Microsoft Teams, the Cisco WebEx, Facebook, WhatsApp, Google of those world, or Zoom. They process the data. And all those participants in the communication flow have different responsibility from a data privacy standpoint. The same for the data stewards, data custodians, the people that are responsible for the safe custody, transport, and storage of the data. And obviously the data owner as well. You as a patient, you have some obligations in the sense that if you give your consent to give some data, obviously you gave your consent. So those data can be then freely made available in some different contexts. So now that we understand a bit the key roles of for those patient data ownership related to communication between patient and healthcare providers and other stakeholders, it is important that the patient data flow between different data stores, and that the boundaries, and that you understand that the boundaries are often blurred in practice between those different stakeholders. And there is still a very massive and significant challenge for healthcare stakeholders to respect those data privacy principles. So as an example, I will now do a deeper dive for you to compare, based on publicly available sources only, 15 chat audio video services which are being used today in an healthcare context. So we'll look at Apple FaceTime, ClickDoc, Doctena, Facebook Messenger, Google Hangouts, Hospify, MedCrowd, MedicBleep, Pando, Silo, Slack, Microsoft Teams, Cisco WebEx, Teams, WhatsApp, and Zoom. So this comparison is based on two major elements. The first one is what I call high-level functionalities. It's really related to what are the functionality which are being offered by the platform. And the second one is healthcare data privacy, including data security, in a high level only. Meaning, are those tools to some extent respecting some compliance framework for data privacy, and what are their associated policies? So if we look at the different functional comparison between the different tools that I ranked from A to Z in alphabetical orders, you see that the majority of all the tools have obviously the standard functionality of instant messaging and support of video and audio for the most of them. They also, for a lot of them, have collaborative workplace, meaning that you can do file sharing, you can co-edit file. And you have also for some of them, what I call native multi-platform support, allowing to exchange information between different platforms in a native way. For instance, Google Hangouts as a connector through WebEx, Zoom, through G Suite, for instance. The same for Microsoft Teams, which has native integration with WebEx and Zoom, or Slack with WebEx, Google Hangouts, Teams, and Zoom. So because those platforms, the largest one obviously wants to play the role as Carrefour between those different tools and remain at the heart and remain as the platform that the users will use mainly to communicate towards other platforms. Another element which is interesting is looking at data geolocation functionality. Are the data that are being stored, meaning chats, instant message, voice calls, or video, being data geolocalized or not? So do you have the ability as a user to determine where the data needs to be stored? And in some cases, it's absolutely clear where it is stored. In other cases, it's absolutely unclear. So there's still a lot of discrepancy here in this area of data geolocalization. Then you have specific function like blurring of video backgrounds to enhance the privacy of the communication, or even patient face blurring, which is a very interesting feature that, to me, while looking at it, is only available within Silo now, allowing to face blur the patient. Now, if we look at security and data privacy comparison, there as well, we see a huge discrepancy between the different tools. When I looked at encryption, at rest, encryption in transit, using private PKI keys in private or public key vaults, you see that there is a lot of discrepancies between the different tools. Some of them acknowledge the fact that they do encryption at rest and in transit, even though they do not describe everything in all details. Some of them do describe it better than others, Microsoft Teams, for instance, and Cisco WebEx, in my view, are doing that in a more stringent manner. If you look at data retention policy as well, the data retention policy is very, very different as well from one to another. Some will use it like Apple FaceTime, 30 days, then delete it. Others will maintain it for unlimited, for standards, or just offer the ability to program the data retention in function if you use premium services, for instance. So a lot of discrepancy in this regard. Security and authentication and authorization procedures are also different, but we see that a lot of them try to go to SSO support with some custom MFA authentication, for instance, or support of Auth0 or Azure AD with SAML2. So a lot of different ways to authenticate and authorize, which are often custom. If you look at GDPR compliance, the majority of them claims that they are GDPR compliant for charter and that the charter and control are available. A lot of them also claim that they are ISO 27001, that they have defined compliance with BA for HIPAA. Some of them are NHS DSP toolkit compliance, but in general, the landscape is very, very fragmented yet. Also, the confirmed availability of guidance document for data protection impact assessment, what we call DPIA, is often not made publicly available, which means that there is no ways for an external party to assess whether there is a real data protection impact assessment that has been done. So, in a nutshell, very interesting to see that all those providers are obviously first intention was to make sure that the function that they provide is being used and that people find their tool convenient and that the quality of the tool is good. But there is still a huge progress that needs to be done for a lot of them in regards of data privacy and data security. So thank you, and now we will do the conclusion of all those different questions. As a conclusion, new workplace communication services have and will have a profound impact on how medical practitioners will communicate with their patients, between themselves and with external stakeholders. So the unified communication service provider market is today very fragmented between what I see as business-to-business professional generic solutions, such as Microsoft Teams, Google Hangouts, Cisco WebEx, Slack, and others. Business-to-consumer free solutions such as WhatsApp, Facebook Messenger, Apple FaceTime. And then business-to-business dedicated healthcare solutions such as Silo, Doctena, MedCrowd, Hospify, ClickDoc, etc. Most of them, unfortunately, protect imperfectly the privacy of medical conversation between practitioner and patients, and between practitioners themselves. The fragmented nature of the healthcare data regulations across the world also implies that no solution would fit all. So GDPR framework remains, in my personal view, a strong compliant framework that all service providers should continue respecting, and not only within the EU 27. The principle should be use the most stringent data privacy framework available globally so that you cover yourself in the other territories and other regions of the world where you want to be active in. Trust is, in my opinion, more important than technology. This principle is true for all private communication, but even more so for healthcare-related private communication. The implicit trust that the information won't be undisclosed between patient and a medical practitioner remains, in my view, paramount to foster an harmonious future of our healthcare systems. Thank you so much for listening to me and reading to me. And please relate to the full documents where I post more information. And I would be really pleased to have your feedback on this piece of information and have a positive and constructive exchange of and discussion with you all. Thank you.